Welcome back to Wellness Wave Radio. Thanks for tuning in this morning to ride the wave with us. Each week our goal is to give you at least one suggestion that will make your life a little better. My name is Phil George. I'm a clinical biochemist, a certified personal trainer, and a health coach. Please remember that everything we discuss on the show is for informational purposes only and should not be taken as medical advice. Always seek the guidance of your medical professional. We got a show for you today, guys. We got a show for you today. Right? So I've got Nick and Chris here. We only have a half an hour, so I'm going to try to condense everything into one thing. So Nick was on the show before, and Nick is a best-selling author, and he wrote a really good book called The Boy in the Closet, which I read. If you haven't read it, I highly suggest you read it because you're going to find all the different parts of Worcester in there. You'll remember all the different things and basically what Nick went through. So if you have a chance, read that. And with Chris, and Chris, you're a PCA, right? Yep. And you kind of help keep them on the straight and narrow, right?
Yeah. Yes. Whenever he needs anything, I generally call to respond.
So what we're going to do, basically, going to talk today about if you can go back to the initial one that Nick was on. He's half the person he was.
You ain't kidding. Right on.
So this is going to be kind of a medical show in terms of the journey that Nick went through, and we're going to have and Chris has helped him out. So Chris has seen real and what he needs to done, what he had to do, different things he needed to do to keep Nick healthy, and hopefully it'll help you if you coming down with something. So in fact, we didn't even have a conversation before this.
Right.
So this is purely off the top of our head.
Oh, I'm going to blow your mind today. Trust me.
Okay, I'm ready.
I'm going to blow your mind.
I'm ready.
Okay, well, I've lost 140 pounds. And as you remember, last time I was on your show, I had a hernia that weighed about, or that extended about 20 pounds. It was about the size of a basketball. I've hid it for years. And the fat also helped to a degree. But I noticed the more weight I lost, the more the hernia protruded. I thought it would be the opposite, but it wasn't. Now, I was due to go in and have my hip done on the 28th of last month, and I ruptured the hernia. So I've fought it for years. I've had that hernia for probably 20 years, and I was cursed by getting that hernia. You know, in my book, The Boy in the Closet, I was a professional art thief. We talk about that. I had just had gallbladder surgery, and I had stolen an urn off a doctor's lawn that weighed 400 pounds 2 weeks later after my surgery. I lifted the urn. It came in several pieces. There was a plinth, a base, everything there. And that's when the hernia started. I tore my incision from the gallbladder. That was the start of the hernia. So it was kind of a bittersweet because, yeah, I was ripping someone off, but I paid the ultimate price. So I've told you before in the last interview, I've been clean for 25 years of stealing, of doing anything that I did in my past. And I went back and paid back $3 million to the people I stole from. A lot of these people are dead and gone, but I paid it back to their families. So I lived with this nightmare for years, and to be honest with you, for 2 days, it affected the way I ate. It affected the way everything about me was affected by the size of this hernia.
Yep.
I let no one see this but him. Very few people would see it. I'm not a vain guy, but I've had people come up to me and say, hey, you got a gun in your pocket? Are you stealing something? And you don't know what to say. I'm caught off guard. So in a way, I'm glad I ruptured that. It had protruded out my bowels had come out of I don't know if they're in my abdomen or what.
Hey, let me interrupt you.
It was horrible.
Okay, let me interrupt you. We're going to get so the audience can understand. So one thing, what a hernia is, you can imagine a tire. That's really what it comes down to.
Yeah.
In a tire, you have an inner tube. Okay, you've probably even seen this if you have had a tire. What'll happen, once in a while, the inner tube will penetrate through the outer lining.
Yeah.
And that's exactly what happens with a hernia.
Yeah.
Now, what happens with hernias, we are talking about, it really didn't rupture. It's what they call strangulation.
Right,
true.
You're right,
Strangulation.
yes.
So I want to explain what that means.
Because that's why, yes.
I want to explain what that means. So
Yeah,
that happens. So you can, and I have a hernia right now. I have a left inguinal hernia right now, and I know I have it.
Yeah.
But what happens, it's just protruding a little bit. But what happens, if it protrudes too much, what happens, it goes around it, and it's called strangulation, like this. And it cuts off the blood supply to the intestine, and that's extremely dangerous.
Yeah.
Extremely dangerous. So you're lucky you're small.
My surgeon for 5 years is saying you're just on a, you know,
You're on the
this
ball.
is a lottery. Any day now.
No, it's Russian roulette.
Yeah,
It's Russian,
you're not
Russian
kidding.
roulette. So you should have had this taken care of. What happened is, I'm going to back up because this is kind of a medical show.
Sure.
So what happens is, I had a right inguinal hernia repaired. I had an umbilical hernia repaired, and I currently have a left inguinal hernia. But one of the things I did, for the audience to know, something called a truss. Now, what a truss is something you wear, and it kind of puts pressure where
Right,
it is, and it
yep.
pushes it down.
Yes.
I still exercise every day.
Yep.
I lift weights, but I have this truss.
I've got a a full length one.
You got a full.
Yeah.
So what it does is it helps put it in. So I'm planning on not basically having this done unless I have to.
Right. Yeah.
And I got to be careful of the strangulation.
When you hear my story, what happened, you won't have it done. You won't. So I had one down here taken out as well, the surgeon. He said, I did a too far. So he said, I did this one, but you had one down there.
Yeah, you did an umbilical hernia
and then an
inguinal hernia, right?
Yes. But I hate to say this, I was unaware that was going to happen. When I woke up from surgery after 10 hours, I looked down and I was ecstatic. Not that I survived the surgery, that I didn't have a catheter in. I was just beyond myself, because that was my biggest fear. I went in high-fiving the surgeons, the anesthesiologist. I was just passing out scratch tickets. You know, they're like, wow, this guy's a hot shit. I'm like, look, I got too much living to do. I don't want to die. And let's cut the, and just, let's get through this. Almost said it. So I come out, but then again, 10 minutes later, I lift my blanket up, and I'm bleeding down there.
Let me back up.
Yeah.
So the first surgery was for the umbilical hernia,
Yes.
but you hadn't had the inguinal hernia done yet.
No, I didn't know I had that. He said we found another hernia.
So the umbilical was the big one.
Yes, this one.
The
Okay.
pressure
Yeah.
was so bad from the umbilical that he wasn't even aware that the other hernia was there. And it was protruding so much, and it was so large that he wasn't feeling the other side.
It looked like a freak. We called it the alien.
Yeah, the alien.
Alien. It
Yeah.
was gross.
Yeah.
It was horrible.
Yeah.
You know, you see like on TV, these people that have these big, lipoma or whatever on that doctor show, it like on the side. Well, that was my abdomen. And I mean, hey, I'm a gay guy. Image is everything in this world.
Yeah.
I mean, I'm an old guy, but still, I take pride in the way I look, the way I dress, but I couldn't hide that. And I tried everything to hold it in, couldn't put the pressure on it. But when I woke up from the surgery, I noticed my testicles were purple. And now, the size of softballs. I wasn't worried about this. I was worried about my manhood.
Sure.
I'm like, hey, what's going on? So that's when they told me, look, there was another hernia. We took it out. We had time. We felt we needed to. I'm like, well, but that was a nightmare. And then I had to be recatheterized for that. Couldn't go pee. So it was a nightmare, Phil. I'm not kidding you. I love my surgeon to death. I rewarded him handsomely for succeeding and living through this process. I'm good to people that are good to me. And I gifted his wife 3 pairs of gold diamond earrings, 2 Pandora bracelets, a couple of necklaces, but that's the kind of person I am. I'm wealthy. I'm good to people that are good to me, number one. So, but that's not the whole story here.
Oh, let me stop you.
Yeah.
One thing, so the audience knows. So basically, in terms of hernia. Now, a lot of people don't know this, but basically, there's 2 types of surgery they can do with the hernia. One of them is called a mesh.
Yeah.
And what they do is a mesh, and they put it in there. It's kind of like a plasticky thing. The other one, a lot of people don't know about it. It's called the Canadian procedure. What the Canadian procedure is, they actually sew it up.
Yep.
They go in there and they sew it up.
Yeah.
So but before I knew better, both of my surgeries with the mesh, and that was 30, 40 years ago, and everything's hunky-dory, everything's
Yeah.
fine. But if I had to do it again, because what I found out later on, the mesh, sometimes it doesn't hold and it comes apart.
Of
I was
course.
going to mention that.
Of course.
Yeah, so that's what it is. So
Yeah.
guys, this is
Yeah.
one suggestion.
Yeah.
If you go in there, ask them to do the Canadian method.
Canadian.
Okay.
Because what happens is, if I had it, fortunately for me, and it probably 80, 90% hold out fine, but
Yeah.
once that mesh starts coming apart,
You're also
Sure.
prone to infection too with the mesh. I've seen that in the past where they've actually recalled.
Oh, yeah, they've had
the
recalls.
pieces to
Yes.
the mesh
Yes, they
pieces
have.
that they put in.
Yep.
And there's been a couple of lawsuits. Mesh is actually, I hear they're trying to do away with it. At least that's what I've
yeah,
heard.
the Canadian, in fact, I was listening to the doctor radio, and they had two sports doctors on there, and this was years and years ago,
Yeah.
and that's specifically what they talked about, and I had no idea.
Sure.
I was like the average person. I thought, geez, they put the mesh in, doesn't work,
Yeah.
they take it out, put it back.
Right.
No.
No.
It's coming apart. It's all over your body.
When I saw my urologist prior to this, all the staff had to come in the office to look at this. A lot of residents, student nurses, they're like, "Do you mind if we use you as a guinea pig?" And I'm like, "Yeah, I do mind. I'm a very,
But they've never seen anything like this
No,
before.
they haven't.
That's why.
It was
you-
impressive.
In the OR room, they were bringing other doctors in. They actually had 2 OR rooms set up for me. They had the robotic room,
Yeah.
which he was hoping he could do. He said, had I not lost the weight, it could not have been done that way. But they still cut me. So that's why, hence 10-hour surgery. But, this has been a bittersweet battle, Phil, and I'm going to tell you. I don't lie about my life, my addiction, what I've been through. And I got addicted to drugs a year ago. Now, I've been clean for 35 years. Off coke, speed, all the shit. Oh, I'm sorry. All the stuff I did. I'm sorry. Will that be cut out?
We probably could do
Okay,
something.
I'm sorry. I got hooked on coke, meth, and speed. I couldn't have done one. I couldn't have done I had to do them all. And I'm not gonna lie, it enhanced the weight loss process because I wasn't eating. I wasn't eating for 2 or 3 days. Now, mind you, at the time, I'm on 150 units of insulin, AFib, hypertension, everything you can think wrong with me, 6 blood clots, I've had it. But I was determined. I said, okay, for the first time in my life, I'm losing the weight. I don't care how I'm doing it. I don't advocate that to anybody, but the minute I came off the drugs, been off them, maybe 8 months, a year?
Yeah, I would say that.
I do a show as well I told you, my show, Hidden Treasures. I announced to my guests that I too had fallen, taken the path of destruction, because people were coming up to me, people I work with, people I know. What is wrong with you? You're wired, you're flying. I lied to a lot of them because I was lying to myself. Now, how I didn't go into AFib, how I didn't have go into cardiac arrest is beyond me when I was doing below 15, 20 times a day. I mean, I'm an old guy. I'm 65. I mean, I'm no spring chicken. And usually at that age, when you've stopped that long, as you know, it kills you. You stroke out. And mind you, my blood pressures were running 240 over 150. I wouldn't listen to the doctors. Till finally, one of my doctors called me out on it. He says, I want to know what you're on. Your heart rate is through the roof. Your blood, what's going on? Now, this doctor I've had for 28 years. I said, look, I'm not going to lie to you, but I got a lot to lose, Phil. I mean, I'm a high-profile guy. But I said, look, I fell off the bandwagon. I'm not proud of myself. I never thought in a million years I could do it, Phil. After 35 years, I never thought I could. I almost picked up a bottle, too, and started drinking again while I was doing that. So I tell everybody out there, never say never. I say once an addict, always an addict, and now I'm living proof of that. Because I stopped using that term for a long time, because I said it couldn't happen to me. But all I needed to do was to taste that once.
Do you remember AA? That's what they say at the beginning of the AA
Yeah.
meeting. Hi, my name is Nick, and I'm an alcoholic.
Right.
Because what happens is, it's interesting you should say that, because I just did a seminar down in Plainville for a mental health group, and what they talked about, we talked about dopamine.
Right.
And dopamine, what happens is dopamine and serotonin is kind of these neurotransmitters, kind of feel good, but dopamine basically, it gives you a reason to get up in the morning. That's why people
Sure.
are depressed, they don't have enough dopamine.
Yeah.
So what happens is, what they deal with addicts, in fact. That's one of the things they
okay.
do. So what happens is this, is that initially you take the drugs because you want to feel good.
Right.
You take more, and then eventually you need the drugs just to feel normal.
Yeah. Exactly.
You need it. So what happens is dopamine, what happens, you call it downregulate.
Yeah.
You have dopamine receptors in your brain, and what happens is, as you keep bombarding it with the stuff, you need more and more.
Right.
Like, if you drink, right? If you drink,
Right.
and you're
Yeah.
drinking one, and then you're drinking a 6-pack and a this, and then
Yeah.
eventually you keep doing more and more of it.
Yeah.
So, and again, I think, you correct me if I'm wrong.
I'm still an addict today.
Yeah,
I still use.
and you have to.
I'm off the speed, meth, and coke, but I'm still an addict, and I don't hide that. I'm still an addict every day. So I mean, but I'm a functioning addict, and again, I function differently under different type of substances. Like most people, some people can be a happy drunk. Some people. I function well under opioids. I function fine. I do not function well anymore, as I found out, under the other three. Now, I took a friend with me down this path, but I'm not going to mention their name. But I took a friend with me down this path of destruction. And that bothers me a lot. It does. It bothers me a lot. But I surround myself with two sets of people, Phil. Either my friends that are gangbangers, drug dealers, addicts, or high profile. Like Saturday, I was out buying Louis Vuitton and Gucci. I have a wide range of friends, associates, and people but I won't change my background, where I come from, what I've been through for anyone. And that's why I associate with all types of people. I find a lot of these people that are addicts like me have had a life similar to mine. And you never know what journey your life may take, and you may wind up out on that street collecting change or living in a bag or a tent. I fortunately have never been in that position, because I vowed once I can't support my habit and I have to take the drugs, because as you know, I was a drug dealer, I would stop. But I never did my own stash. That's lesson number one in the drug business. You don't take your own drugs, or you go under. I mean, I've had guns pulled at me. I've been pulled into vans. But I surround myself with people that protect me, because I'm crippled now. I'm disabled. I'm a former shell of what I used to be. So, after I get the hip done, that's the next surgery, then I hope I'm that same guy I used to be. I'll join the gym. I'll do what I got to do and get my act together,
Yeah, because the audience doesn't know, you got to read the book to see what Nick's been through.
Right.
But there's one thing I got to say about you, Nick, is you're very optimistic.
I am.
And that's what it is.
am.
With all that, and with all the stuff you've been through, I'm not
Yeah.
using the other S word.
No,
With all the
right.
stuff
I'm
you-
sorry. but let me tell you this, Phil. In 1 year, and I'm bringing myself down to a level I hope they understand. In 1 year, I tried killing myself 4 times. Now, that's what drugs will do to you. So I am telling people, do not do it. Easier said than done, correct? Easier said than done. Once I've been on every drug known, 20-something, but Heroin is the worst I have ever gone through withdrawals on. It is a nightmare. I don't know if you've had people on. I don't know if
No
you've
no
talked to
heroin.
people, but
No heroin
it
people,
is
no.
the absolute worst you can imagine. Now, I tell people, Vicodin, Percocet, piece of cake, Coke, that you have no idea what you're going to go through. And again, I make sure I don't run out, but I am still a functioning addict. So, I mean, again, it takes a lot of guts for me to come on and admit that. And again, like I say, when my book came out 2 years ago, I mean, I don't pass judgment because I have no room to, you know? I had more men come up to me, not just women, but men come up to me after that book and say, I was sexually molested. I've never told my wife, my kids. They thanked me for coming out with my story about the priest, about the art teachers. Again, people need to know my journey as to why I took that life as a cowboy. I mean, you know, I didn't have the luxuries most kids did. When you grow up in Great Brick Valley like I did, Maine South, oftentimes you don't have a choice. When your mother's an addict, married 5 times, a brother kidnapped, I mean, you know, you don't have a choice, Phil. I would see my mother down bottles of cough syrup at 10, take boxes of, you know, sinus medicines, everything. But I felt if she does it, it must be good. I do it. But I didn't know a tenant wasn't good for me. I mean, I had hypertension at 11 years old because of all this stuff I was taking. But again, you know, I mean, how I lived to this level, I don't know. I don't know. I mean, you know, but every day now, I told you I'm giving away a $30,000 storage unit with my show. I'm gifting it to the station because I'm at a point now, Phil, where I'm fortunate, I'm successful. I have spent the last 25 years paying it forward. The only one, though, I hurt is myself with the addiction. I've had every friend in the world try to help me. Until I can help myself with that again, it won't happen. But like the weight loss, like everything, you got to want it here and here, you know?
Well, the other thing I think what you might want to consider, other things you can do, because what they found, like with AA, with any kind of a group, the people, I'll give you a good example, because I had my alma mater, Anna Maria College, when I went to school.
Yeah.
I had one of the psychologists on the show, and he brought in first responders, police officers, firefighters, you know, EMTs,
Yeah.
all that stuff. And what he found is a tremendous amount of burnout with these people.
Yeah.
Because what happens is it's the stress, especially with the cop. You see the worst of society
Of
all the time.
course.
So you come home. In fact, when gyms when I used to go to, one of the guys was a prison guard.
Yeah.
And it's awful. They become alcoholics.
Oh, I know a
yeah,
lot of
yeah.
addicts that are prison guards.
Because you go in there and all you get is
Right.
the worst,
Yeah.
the worst of humanity.
Yeah.
And he said what happened is he would be able to train. Let's just say that you're the captain of a police force or something. He would train you on how to deal with this stuff.
Yeah.
Because in other words, if okay, let's say I'm in drug rehab and I've never taken a drug in my life.
Yeah.
I try to tell you, you're going to say, "What the hell? You don't know."
I know.
Yeah.
I say that to people all the time.
You don't know. But
You don't know.
This is where I'm going now.
Okay,
This is where
all
I'm going.
right, okay.
There's an end to this.
Yeah.
For the next part of your life, you could actually talk to a lot of drug
I've
addicts.
been asked to do
Yeah,
it many
and
times.
see, because what happens, they're going to listen to you.
Yes.
It's the same thing. Like, let's say you wanted to lose weight.
Alcoholic.
Yeah,
So
right, yeah.
I can talk to people.
Yeah,
about
Yeah,
because
right.
you've been through
I
it.
don't want to throw you out or
Yeah.
admit anything you have, but he too, that's why I wanted
But
him
see,
on.
that's the point. Then you can talk to other people struggling. Okay, Chris, what did you do? What
Right,
did you do?
right,
What
true.
did you do?
Right.
What tricks
Yes.
did you come up
Right,
with?
yeah. Yeah.
Because somebody that hasn't been through it,
Right.
that's why they say Weight Watchers is so good.
Yeah.
The other thing is, Weight Watchers, Alcoholics Anonymous, and that what happens is they can commiserate with each
Right.
other.
It's called
Well,
culture. They create a culture, and it's not just like saying the words. They present situations because they're familiar with the situation, and then they're able to present it to you and then help you
But
through
you know
it.
what, Chris? And I don't want to put anybody down here, but I live this life. I have been to very few meetings over the years, never AA, and I'm an alcoholic as well. But I would go score my drugs at the meetings. And we all know it. It's kind of an underground thing, but a lot of us go there to meet, talk about drugs, but also score. And
Yeah, what better place?
we do.
Do you remember, they used to have the whole thing, it's a funny thing. I think I know what it was. It was 2.5 Men with Charlie Sheen.
Yeah, okay.
And he went to the sex addicts meeting,
Oh,
right?
yeah, right.
What a better place.
Can we do that on another show? Can I come on the next show?
I should give you
'Cause
30 minutes on
I
that.
gotta give you some stuff on that now. I'll take on another turn.
I can give you 30 minutes on that.
Yeah, I think I'm going straight, Phil.
The
So,
90s
you know,
were the 90s were crazy for
right.
me.
Yeah, so,
Yeah.
but that's the whole thing a lot of times. But again, unless you've been through it, unless you lived, unless you found a way, if you were overweight, what did you do?
Well, I went on Ozempic. I went on Trulicity. I went all of them, but I wound up getting pancreatitis, other problems. I said, I'm not doing it. I'm not saying they're not great drugs, but it didn't work for me.
Well, let me say this: they're not great drugs.
Right. No, that's why I'm
not-
saying that.
don't
But
tell-
I'm not saying that, but I'm just saying
Ozempic.
it didn't work for me.
Read the side effects of those.
Yeah,
Doesn't work
you're
for
right.
me.
And so with the whole thing, Ozempic really can mess you up big time. Plus, it's wicked expensive.
Oh,
The
my
new
God.
thing is too with Ozempic that just came out recently was it's causing blindness or
Yeah.
loss
Wow.
of vision, which is like 6 months,
Wow.
I think. So I would tell people stay away. Just try to get into a gym or
Yeah.
just change your eating habits.
Or
slightly.
even better,
Right.
Don't
wait,
get
wait,
discouraged.
yeah.
Chris, even better,
Don't-
contact
yeah,
me.
right.
Contact me.
Yeah, yeah.
Phil George
Yeah,
at
right.
charter.net.
Yeah, right.
And what I'll do is, because what I like to talk about, you get 3 first. So one thing, I'm a biochemist, so I understand, the body.
Yeah.
Number 2, I'm a health coach, and I'm a certified personal trainer. So instead of going through 3 different people,
Right.
you get all
Right.
in one. How's that for
Right.
self?
Hey,
How's that for
hey,
self promotion?
There you go. Hey, right on. I'm working on 2 more books,
We're gonna have to get it done.
so
you have to
you
get
gotta,
me back
yes,
on.
a murder mystery. Great. 1940s in a movie theater.
Yeah. The other thing I'm going to say, correct me if I'm wrong, but the other thing, you're dyslexic too,
I
right?
don't own a computer. I don't read or
Everything-
write.
everything's-
Everything's written by hand.
Yeah.
When I gave Donald 50 notebooks with the first book, Johnny and Baby Jumbo, he couldn't believe it. But that's why we collaborate and work so well together. He reads. He's the best. He
Okay,
is.
we're coming up to the end of the show. So first of all, thanks so much for coming on.
Thank you.
I hope you got a lot out
Did
of
I
this.
blow your mind a little
you did,
bit?
You
All
did.
right, okay.
So The Boy in the Closet, if it's bestseller, check it out. You'll see all the Worcester stuff in there. It's really great. I really enjoyed it. When you have your next books
you
come
got
out, we're
it.
going to have
Yep.
you come on for that. So again, if you have any questions, email me, philgeorge@charter.net. We give seminars. If you want us to go out and give a seminar at the senior center or wherever, we'll be happy to come out there. Any questions that you want me to cover, any topics on the show, I'll be happy to do that. Any questions about lab work or supplements, feel free to email me, philgeorge@charter.net. And that's it. Thanks for coming on, guys.
Hey, thanks.
We'll see you next week.
Thank you.
One of the most common questions I'm asked as a biochemist and health coach is, what are the best supplements to take? Choosing supplements is a tricky business. Many companies have poor quality control and questionable ingredients. In the past, I had to send clients to several different websites. I am now able to offer one-stop shopping for all the quality brands I recommend, with no shipping cost and a lower price in most cases. Just email me, philgeorge@charter.net, for a free consult.